Have you ever contemplated the rising tide of violence against healthcare workers? It's a disturbing trend that seems to be escalating, and it begs the question, why? One potential answer lurks in a legal shift that has silently swept across many jurisdictions, stripping patients of their ability to sue doctors. This change has removed what we might call civil stingers, legal remedies that, while not perfect, gave patients an avenue to voice their grievances and seek redress. Now imagine being a patient, feeling wronged or neglected, yet having no legal recourse. It's not hard to see how frustration might boil over into aggression. But that aggression alarmingly seems to be increasingly directed at healthcare workers, those on the front lines of patient care. It's important to clarify that violence against healthcare workers is not a new phenomenon. It's a long-standing issue, one that has prompted a raft of measures aimed at protecting these vital professionals. Yet these measures, while important, do not address the root cause of the problem. They're akin to putting a plaster on a deep wound. It might stop the bleeding, but it doesn't heal the injury. The healthcare system is often lauded as a paragon of fairness and equality. It's a comforting thought, but is it an accurate one? When patients lose the ability to sue doctors, it can feel as though the scales of justice have tipped. And when that balance is upset, people can feel powerless, frustrated, and angry. These feelings, unfortunately, can manifest as violence against those who are simply trying to help. So, what have we gleaned from our discussion today? Firstly, the rise in violence against healthcare workers is a complex issue. It's not solely due to patients losing the ability to sue doctors, but this legal shift has likely stoked the flames of frustration. Secondly, while there are measures in place to protect healthcare workers, they don't tackle the root cause of the problem. A sticking plaster solution is not enough. The system needs to address the underlying issues that lead to patient aggression. Finally, this situation forces us to scrutinize our healthcare system. It may not be as fair or as equal as we like to think. If we want to stem the tide of violence against healthcare workers, we need to start by addressing the systemic issues that give rise to patient frustration. It's a sobering thought, but one that is critical if we want to ensure the safety of our healthcare professionals. After all, they are the ones who care for us when we are at our most vulnerable, and they deserve to feel safe and respected in their line of work.